Good afternoon, everyone. I hope everybody can hear me okay. My name is Terry Canancer, and I have two of my colleagues with me, Juliet Souders and Coleman Simpson. We're three retirement specialists in the benefits office here to go over planning for retirement, helping you understand retirement health benefits. There is a chat function, and please feel free throughout the presentation to ask questions. Coleman Simpson is going to monitor the chat as Juliet and I are going to go through the slides with you. So we're going to get started. What we're going to cover with you is the benefits that everyone receives from UK, what you need to know to retire, a review of the dental, vision, and life insurance plans, the health insurance plans options if you're under age 65. If you're 65, that's Medicare eligibility, and the benefits are a little different. And retirees actively working at UK at any age. So let's start with what everybody receives from UK. All of these free consultations are offered to you now as employees. So we want to make sure you know about these resources, but they also continue when you retire. Financial planning from Cap Trust and Enrich. Cap Trust is an independent advisory firm that provides investment advice to UK retirement plan participants. So if you need help navigating your investments and other financial priorities such as budgeting, you can rely on their advice program. You probably will be getting a lot of requests to attend a lot of financial webinars from Cap Trust, and we encourage you to participate in them. Enrich is a program that provides a lot of online information for about financial wellness to help you with budgeting and money management, just to name a few of what they offer online for employees. TIAA Craft and Fidelity are resources. Whoever you're investing with your retirement, we encourage you to have regular meetings with a Fidelity and TIAA representative so you can understand better your portfolio and how to access your funds at retirement. How is your funds doing? Does there need to be some adjustments with your investments? How long is that money going to last you over your retirement years at retirement when you start pulling out money? Know your RX pharmacist. This is part of the benefits office. You can talk to a pharmacist who will advocate for you, help you understand the least costly of medications that are available to you. If there's a way you can save money on your medicines, they would probably know how to go about doing that. You'd be surprised what coupons some of these pharmaceutical companies have out there that could just be applied to your prescriptions to lower your out-of-pocket cost. Elder care specialist, we have a elder care program that can provide free resource information to you if you're caring for an aging parent or a loved one by giving you the support and the resource knowledge to help you in your caregiving. We have therapists with Work Plus Life Connections program. You can have up to 5 free counseling sessions with a therapist annually for you or your family members. And I should note that these therapists, as well as the elder care specialists, they host support groups every month. And as well throughout the year, a lot of presentations. You can get involved with a lot of their programs. Dietitians through the health and wellness programs, they manage a lot of weight loss management programs. And then a whole lot more, such as health coaching, fun opportunities, fitness membership through MoveWell, very least cost employee gym, and retirees can join their programs at retirement. A lot of wellness opportunities through the health and wellness programs, like an annual 5K. The benefits office, we host an annual retiree fair in the fall. This is just for retirees and a great opportunity to talk to vendors, your benefits. We have probably 20 to 30 vendors there, some not part of UK, but community vendors. A way to get your annual flu shot if you're interested in that. So when you retire, be looking out for this postcard, an invitation to get involved in our retiree fair. Activities and more through the Osher Lifelong Learning Institute. If you don't know about the Osher program, look into their program because a lot of their activities and their programs they start, you can participate as young as 50 years old. And then if you are 65, you can take courses at UK for free through the Donovan Scholars Program. So let's look at what you plan, when do you plan to retire? First, there's no set retirement age. If you're looking to retire early, what's considered early retirement is when you're not yet 65 years old. You have to have 50 consecutive years of service and you have to meet the rule of 75. This is your age plus years of service. They have to equal 75. So we're looking at two criteria that you have to meet for early retirement. If you're staff are encouraged to give a 90 calendar day notice. Normal retirement, regardless of your years of service, if you're 65 years old, you qualify for normal retirement, and staff are required to give a 30 calendar day notice. Faculty is not noted here, but if you're a faculty member, especially teaching faculty, it's recommended that you give a semester's notice. Phased retirement is a program. We're going to talk more about that on another slide. But basically, phased retirement is something you can consider prior to retiring from UK. If you're 60 years old and you have 15 consecutive years of service, you could qualify for phased retirement and can have a phased retirement agreement up to 3 years. So what's your official years of service and what is your insurance is, excuse me. Sorry, I had a little note come up on my computer screen. What is your official years of service? And if you're trying to understand if you qualify to retire, what's your health insurance going to cost you, or if you don't know if you're eligible and you want to know, reach out to the retirement office, ask for a service check. And the best way to reach us is a retirement email, retirement@uky.edu. And it goes to all three of the retirement specialists and we will respond to you. We check that regularly and we would give you a service letter and tell you what your insurance would cost you. More about phased retirement and how that works for you if this is something you're considering. This is a program that you could be on up for 3 years, only up to 3 years. You're going to reduce your FTE, and this also reduces your salary. If you're approved for phased retirement, you can only work at least no more than 80%, but no less than 50%. Your salary is going to be reduced based on your FTE. You have the same insurance rates as full-time employees. So even though you're reducing or if you go to half-time, you get your same full benefits. Even the retirement match, the 200% employment match continues. One of the perks of phased retirement, in addition to getting your same insurance benefits, is that you can tap into your retirement funds to supplement your income. And this important bullet on the very end is very important because phased retirement is a program that's not available to everyone. Your department, not HR, approves phased retirement agreements. The conversation truly starts with your department. So have that conversation with them first if you know you qualify and see if that's something your department can approve for you. Some more details on early retirement and the requirements. I mentioned earlier for early retirement, your age plus years of service have to equal 75, but also you have to have 15 consecutive years at a 100% FTE position. So if you're in a position that's a zero point 0.9 FTE or zero point 0.8 FTE or 75% FTE, you might have to work long. Well, you're going to have to work longer to get your 15 consecutive years. 15 years working in 100% FTE is equivalent to 20 years working in a position classified at a 75%. And those years have to be continuous with no interruption, and it has to be in a regular position. Temporary service time is not going to count towards retirement years of service. So again, having that service check with benefits, if you've had some variations in your FTE, might be very important to have way in advance so that you know when you qualify for retirement. Now, the rules for normal retirement are very different. Just by turning 65, you're qualified for retirement. To have access to health benefits, you do have to have at least 5 consecutive years and 100% FTE equivalent status position. For getting the health subsidy, getting the health credit, you have to have 15 consecutive years and 100% FTE equivalency status. And your date of hire has to be prior to January 1st of 2006 in order for the health subsidy. Again, those years have to be continuous and has to be a regular position. Temporary time does not count. And before we get into the health insurance cost, we want to talk about some other things that we go over with you in retirement benefits meetings. A lot of questions come up with your unused sick time. You can convert your sick leave if you have at least 66 days saved up in your TDL balance. If you were hired prior to July 1st of 95, you have the option of converting that to a financial payout, or you can use your TDL days to move up your retirement date. Let's look at the financial payout. The financial payout consists of getting 22 days paid at your hourly rate. The remaining hours, they do get paid out, but only at 10%. If you're having a benefits meeting with us, we'll estimate what that payout would look like for you on your final check. Now, another option is you can use your TDL days to move up your retirement date. So this might come in handy if you have 5 months of TDL, for example, and you wanted to retire 3 months earlier. You could use those dates, the TDL days, to move up your eligibility. You also have that option, especially if you're not qualifying for the payout and you were hired after July 1 of 95, you can convert that to move up your date, but also to add to your years of service. If you are someone that you know your premiums are based on your age or your age service matrix, and you don't have 25 years of service, but you're close, we could look at using those the days to add to your 25 years so that you get to that lower health insurance premiums. So again, we would have benefits meetings with you before you retire and kind of see if you could benefit and take advantage of the TDL conversion options. Unused vacation time. You are eligible for a payout of 1 year's accrual if you have that in your balance. So if you work 40-hour work week, you're 100% FTE. That's 160 hours that you qualify for a vacation payout on your final check. And something we would talk to you about is payouts on your final check, especially if you have a sick payout and vacation payout. That could be a lot of taxes that you'd have on your final check. you would have the option of tax sheltering that and putting that into a voluntary retirement plan, such as your voluntary 403(b) option. And we could look at that. We can't give financial advice and benefits, but we would refer you to your tax advisor, your TIAA Fidelity representative, and even Cap Trust can give you financial advice of what to do with that, with the payout on your final check. Some other benefits to talk about and to look at retirement is your basic life insurance policy. It is a term plan that ends when you retire. However, if you have optional life insurance through Prudential, which is term life, there's an option to convert that to a private insurance plan with Prudential. The group discount does go away, but it's an option that you have at retirement. NPM Group has universal life insurance. So if you have an NPM, universal life plan, it is critical that you talk to NPM Group to port that policy so you can take it with you because that policy has a cash value. But also, a lot of people consider just porting it, taking it with you because it's not term life insurance and the premiums don't go up as greatly as a term life policy would at retirement. All right, I am going to now turn it over to Juliet, and she's going to get in more of the cost of insurance when you retire.
Thanks, Terry. So we're going to talk a little bit about the cost of insurance and the differences based on your hire date and your years of service. So when you were hired, how long you've worked at the university, the date and age of your retirement. So will you retire before the age of 65 for early retirement, normal retirement at age 65 plus, or a phased retirement over the age of 60? And then also your work status. If you're planning to return to UK as a working retiree, we also have different health insurance rates based on if you're returning to work after retirement. So just as a general overview, all the insurance rates for retirees, we do have them on our website and the plans are always updated. And then every year during open enrollment, once you do retire, you will receive a benefits booklet in the mail, an actual physical copy. And then again, we also have the PDF version of that on our website that you'll receive just to keep you updated on the costs and any changes to our plans. So our dental insurance in retirement, we have two different carriers. There is UK Dental and Delta Dental. They are the same carriers as our current employee plans. There are a few changes in retirement, but if you have over 5 years of service at your retirement date, then you are able to stay on a dental plan with UK. All of the plans do cover 100% preventative care, so that includes cleanings. It's important to keep in mind that with UK Dental, you can only go to the UK dentistry clinics. And then with Delta Dental, we have in-network providers, but pretty much most dental practices in this area and across the United States do accept Delta Dental. There are two different coverage levels for both carriers. So we have the costs here showing based on if it's retiree only, and then the highest cost if you're adding your family members, so your spouse or children or your whole family. All of the plans partially cover minor restorative work and some cover major restorative and orthodontia. Again, more detailed information would be in our benefits booklet and online, but this table gives you an idea of the ranges to expect. And if you have less than 5 years of service, then you're not able to stay on a dental and vision plan. So that's just something to keep in mind as you consider your retirement date. For vision insurance, again, if you have 5 continuous years of service or more, then you are able to stay on a vision plan. We have our 2 different levels of iMed vision plans. They cover annual exams and savings on contact lenses, glasses, lenses, and frames, and then also a discount for LASIK and PRK laser vision correction procedures. And as you can see here with this table, it's the same idea with the retiree only cost for the iMed Vision Essential is the lower one, and then the enhanced is the higher cost there, and you can add dependents to the plans. These are the same plans that we have for employees, so there's no change like with the cost for the UK dental. It's not the same with this. This is the same cost, same plan as you have now as an employee. So just a general summary of the health insurance plans. If you're under the age of 65, then you would be continuing on the same employer plans that we have. There is a different cost based on your hire date and the date you're eligible to retire. But again, you would be able to stay on the HMO, PPO, RHP, all of those plans. If you're age 65 and over, we have the UK Medicare Advantage plan, which is in conjunction with Medicare. You would enroll in Medicare to take that plan. And it's if you're fully retired and you're done working. And then there is a reduced cost and a different rate for retirees actively working at UK at any age. So if you're under the age of 65 or over the age of 65 and you want to continue working in a 20% FTE or higher, then you're able to stay on the plans, and we'll talk about that a little bit more as well. So this is for folks who are eligible to retire before July 1st of 2007, which admittedly there are not a ton of people in this group at this point. But if you're under 65 and you were eligible to retire July 1st of 2007, then this is what you could expect for your rates. This is for this plan year. But we can go to the next slide. So there are differences based on your hire date. If you were hired after January 1st, 2006, you would not receive a health subsidy in retirement. So you can expect your monthly cost. These ranges, the lowest range is what you can expect if you're under the age of 65 and you have a retiree only plan for the plans listed. And then the higher rate is if you're adding dependents to your plan. Again, more detailed information is offered on our website, so it's easier to tell. But this is a basic range to give you an idea of if you're under 65, you're retiring early, and you're going to be on a UK plan. And then the cost changes. Once you turn 65, you would be eligible to enroll in the Medicare Advantage plan, and we'll touch on that in a little bit as well. If you were hired before January 1st, 2006, you do receive a health subsidy in retirement. Your monthly cost is based on your age and your years of service at retirement. So the more service you have and the older you are, your premium goes down based on that rate. But it is locked in at your retirement date. So if you retire with 25 years of service at the age of 60, that is the rate that you'll be paying for the entire time until you turn 65. So that's important to keep in mind. It wouldn't decrease every year as you age unless you continue working and retire later. This shows the cost ranges. So the lower cost is a retiree only plan, and then the higher cost is if you're adding additional dependents to your plans. So This just gives an overview of the percentages that you are paying versus what UK is paying um, as you have increased age and years of service at retirement. So it does sometimes inform people's decisions based on how much they're hoping to pay for their health plans in retirement. But this just shows some general percentages. So as an example, if you're 62 and you've been working at UK for 23 years, then that would be 45% paid by you as a retiree. And then again, as it goes, your age increases and your years of service increase, the percentage that you pay gets lower. So here, as an example, we use the age and years of service. So this is our age service matrix. This is specifically for HMO, but the UK health credit will cover a majority of your monthly cost. Um, so as an example, if you are 62 years old and you have 24 years of service, and you want to retire as soon as possible, you would still have 6 months before you reach 25 years of service. So if you waited 6 months, your monthly premium would be significantly less. So it would go down from, if you have 24 years of service and you're 62, it'd be 538 there. So then if you wait till you're 62 with 25 years of service, or 63, then it would be 299 or 239 based on your retirement date. The other option with this is that if you did qualify to use your TDL to move up your retirement date, let's say that you had a good portion of sick time saved up, then you could use that to meet your 25 years of service so that you could move your retirement date up and use that sick time to kind of fill in the gap for that. And that's something we would be able to calculate on a case by case basis. So that's something, if you were interested in that, and you had a great deal of TDL, you should just check in with us and we can definitely look at that when we meet with you. Again, these rates here in this table, these are just for the retiree only plans. So if you're adding a child or a spouse or both, then you can see on the right hand side we have the rates to add those per month. And we do split plans. So for example, if your spouse is already 65 and they're no longer working and they're on your plans, then they could be on the Medicare Advantage plan, even if you're younger and still on these employer plans. This is the PPO version of this table. So you can see if you're 62 and you had 24 years of service, you'd be paying $558 per month. But then if you waited till your 63rd birthday and you had 25 years of service by then you'd be paying $248. And then you can see the additional cost to add dependents there on the right hand side. Okay. And this is again the same thing for RHP. So we have information for every plan listed on our website. You can see that here as well. So another thing to keep in mind, and the big question, everyone always has a lot of questions about Medicare because it is new and sometimes nerve-wracking when you're looking at Medicare after never having experienced it before. So this is just a general overview of Medicare. Medicare Part A is hospital insurance. It does not have a premium associated with it, so we definitely recommend that if you turn 65 or you've already turned 65, when you have the chance to sign up for Medicare Part A, you should go ahead and do that. Medicare Part B is medical insurance, so doctor's visits, and that does have a premium associated with it. So you can wait on that until you're finished working and you fully retire. There's Medicare Part C, which is supplemental insurance and is included in the UK Medicare Advantage plan. And then there's also Medicare Part D, which is prescription coverage, and that's also included in the UK Medicare Advantage plan. So, important things to know about Medicare. Medicare Part A and B are required by the government when you are no longer working. Everyone pays the premium for Part B, and some pay for Part D based on income. That's a range, but the premium is based on your modified adjusted gross income and they look 2 years back. So if you're retiring in 2025, they'd be looking at your 2023 tax return. We do have additional information on that if you want to request that information, and we also talk about it during our benefits meetings, so we could give you an idea of what you might pay. But Medicare also sends you a letter at the time that you enroll so that you would know exactly how much you'd be paying every month. With Medicare Part A and B, after you enroll in those two, Medicare covers 80% of your total medical bills, but that leaves 20% that would be out of pocket if you don't take any extra plans. So we do have the UK Medicare Advantage plan, and that adds additional coverage. It includes Part C and D, so supplemental coverage and then also prescription coverage. So those can be that can be a great plan to add on, so that you have additional coverage and aren't paying 20% out of pocket. A good thing to know is that we also do help you enroll in Part B. So if you've been on our employer health plans, and you continue working past the age of 65, you wouldn't get a penalty for enrolling in Part B late, because essentially we sign off saying that you've been on our medical plans and help you with that part of the application process. But then you would take that application once you have it and go to your Social Security office or mail it in, and that would allow you to start your Medicare plans the first of the month following your retirement date. So here are some rates for the UK Medicare Advantage plan. This also, your premium for this also depends on your hire date. So if you were hired after January 1st, 2006, and you have 5+ years of service, then you'd be paying $200 a month for the Medicare Advantage plan. And this is in addition to Part B premiums. So that's something to keep in mind as you look at this. And then if you wanted to add your spouse, you could also do that for another $200 for $400 a month total. If you were hired before January 1st, 2006, then you would be paying $20 a month for your retiree only plan, in addition to Part B premiums. So no matter what you're paying for Part B, that's through Social Security, not through UK. And then if you wanted to add on a spouse, you'd be paying $220 a month with that $200 premium for spouse plus your $20 premium for your plan with the credit. And then it's also, if you have a split plan, let's say your spouse is over the age of 65, but you're not 65 yet, then again, you'd be paying that $200 premium for the Medicare Advantage plan in addition to the Part B premiums. Another thing that you can keep in mind with Medicare Advantage, the premiums are paid to UK for that plan. The Part B premiums are paid to Social Security. A lot of times people will sign up for Social Security checks, and then your Part B premium can just be deducted from your check. If you're not taking Social Security yet, that's okay. You would just set up a separate payment system with them. I think there's a quarterly or monthly payment that you can set up through Social Security. For the UK Medicare Advantage plan, there is an annual deductible. This year it's $185. So once you meet that, you would be paying 4% out of pocket for the majority of your medical costs. There are some copays for urgent care and emergency room visits, but those are pretty low. And again, for everything else, out of pocket would be 4%. There is also a protection built into the plan, and there's an out-of-pocket maximum of $3,000 per member. If it's you and your spouse, that would be $6,000. So that if you had a larger procedure or hospital stay or something like that, then the most you would be paying would be $3,000 for a retiree only, or $6,000 for a couple. Um, so if you return as a working retiree, you do have this as a benefit, um, that there is a lower rate for health insurance, and it does require you to return no later than 3 months after your retirement date if you want the same rates for employee insurance plans, and that's based on ACA stability. So you'd still be receiving an employer health credit if you returned within 3 months of your retirement date. You do have to work a 20% FTE position, and it does have to be temporary. So like a steps position would count as that. Once you retire, you can't return in a regular role. So that's something to keep in mind. But you would still be able to return in a temporary position. And as long as you're working that 20% FTE, then you can stay on the employer version of the health plans. So not the Medicare Advantage plan. You could be on the HMO, PPO, etc. Um, and again, like the rates depend on when you return, and also your hire date. So if it's 3 months after your retirement days or more, so you come back 6 months later, there is still a reduced rate, but it is higher than the current employee rate, um, unless you were hired before January 1st, 2006. Um, and then if you decide to work, if you want to stay on your Medicare plans and you're not interested in coming back onto the employer plans since you're not going to be working that much, then you can have your FTE set at 0.99, 0.19, so 19.99% instead, and then you can stay on the Medicare Advantage plans. So these are just showing some working retiree rates. Again, the range here is based on a retiree only plan versus um, having dependents on your plan. So if you were hired after January 1st, 2006, then you can see those ranges in the blue. And then if you were hired before January 1st, 2006, you can see the ranges there in the orange. That lower rate is retiree only, and the higher rate is retiree plus family. And you do have to be working at least a 20% FTE to be eligible for the working retiree rates on these plans. So this is just our contact information. If you just have general benefits questions, you can call our benefits line listed there. There are 3 retirement specialists, myself, Terry, and Coleman, and we respond to retirement emails pretty quickly. So if you have any just general questions or you want a service check, feel free to reach out to us. We're always happy to answer questions. Once you are retired, you'll contact Joshua Baber for any changes in your insurance plans or questions about specific billing. And then if you have any claims issues, we have a benefits advocate named Debbie Martin, and she's super helpful with resubmitting claims if you need help with that. So thanks for coming. And now if you have any questions, please either write them in the chat or you can unmute and feel free to ask whatever you have questions about. Thanks.
Hi, this is Wayne Beach. I had a question in the chat that wasn't answered, and then I have another question. So, if you retire and, for example, your spouse is working and they have their own health care, but at some point they leave that job, um, are there any restrictions or rules about adding a spouse to the UK Medicare Advantage plan? And is it something you can only do once, or during open enrollment, could you put them on and later take them off and then later put them back on?
I can answer that question, and you may have direct messaged me, so I apologize. Um, so spouses can always come on and off of your retiree health benefits during open enrollment periods or a qualifying event, such as retirement, losing the insurance. That's a qualifying event to be added to your plans. We would just need supporting documentation that the plan is ending. We would pick them up the next day. But yes, spouses can always go on and off benefits. Retirees cannot. Retirees can only defer their health insurance one time over your retirement years.
Right. Okay, that answers that question. The other is currently I have my UK PPO as my primary insurance. I have secondary insurance through my wife's employer because it's free with Aetna. If I, when I turn 65 soon, enroll in Medicare Part A, are you aware of any problems that would cause? I understand how coordination of benefits works with two insurances, but I'm not sure if that'll cause a problem with three insurances.
That's a good question. I can say that with you actively working, like if you're on a PPO insurance,
Yes,
I know that the Part A could come in handy in picking up the deductible if you had a hospital stay, for example.
right.
I can't speak for the matter of if you had the Medicare A with a three, there could be some issues, but maybe a good resource for you might be our benefits advocate, Debbie Martin. That might be a good question to
Okay.
follow up with her on just to see if she's involved. Because if there have been other people like in your situation, she might know if there were claims issues, but there could potentially be a claim issue of who's paying first, second. But I do know that we have many people who, because we do encourage people to sign up for their Medicare A at 65, you can use that with your PPO insurance and that being helpful.
Okay. Thank you very much. I'll contact her.
Okay.
So I see a couple questions in the chat here. Um, Somebody asks, on the UK Advantage plan, can I see a specialist without referrals or just in-network doctors? And then also asking if they can see doctors in other states. The Medicare Advantage plan, it is a PPO plan, so that means that even if you were to move outside of Kentucky or if you were traveling, um, you would be able to see providers outside of Kentucky. It's not limited to the state. It's across the United States. The main qualifications is that are that a provider needs to be able to take Medicare and will bill United Healthcare. Um, if you're interested in finding out which doctors are in network on the Medicare Advantage plan, we do have a UK specific Medicare Advantage. website, and there's a tool on there where you can search a network providers. And the other thing that you can do is you can always ask your individual providers if they take the Medicare Advantage plan. And especially in this area, they should be able to look and tell you if they're in network for our plan.
I have a question about whether a UK Medicare Advantage plan is different from a Medicare Advantage plan that's not affiliated with UK that you see. You get them in the mail all the time and you see them on television. Is UK's different?
Yes, it is. And it's an employer-sponsored agreement that we have with United Healthcare. For example, AARP members, AARP members contract with United Healthcare, and it would be very different. And one of the things that stand out with our Medicare Advantage is it's a PPO agreement. You're not limited to providers. We have retirees probably in every state that have this insurance, that work, that's in United Healthcare's network. So that as well as the prescription plan would be very different from outside plans.
So I see a question about the prescription benefit. Um, the majority of our premium costs are going towards our prescription benefit, and it is a rich plan. I do recommend that if you have many questions about the prescription benefit and you want to find out how much you would be paying for your individual prescriptions with our plan, we have this great resource. They're called the Kentucky Know Your RX Coalition. They're part of our benefits department. And if you reach out to them, you can actually give them a list of your prescriptions and they'll tell you exactly how much those will cost under different plans. So the plan you're on now, but then also the Medicare Advantage plan. And they also have a really great cost breakdown of how our plan compares uh, to other prescription plans that are out there on the marketplace. Um, that's something that we can give you the contact information to if you just give me a minute to pull up the number.
So I have a question. It's in the chat, but it hasn't been answered. I'm not clear here. So if I go to the doctor and they are covered by Medicare and United Healthcare, this Advantage plan, and the doctor orders a test or a procedure, does Medicare approve it first or is United Healthcare approving it?
It would be United Healthcare because when you have a Part C Medicare Advantage plan, the government's contracted with companies like United Healthcare to manage your health insurance. So kind of one of the advantages there is you're only dealing with one insurance company and not two.
Thank you.
To answer your question, it would be United Healthcare. On that same subject, there is a very good website. It's medicare.gov. For those unfamiliar about Medicare in general, That's a place you can go to. It's the Centers for Medicare website. There's a Medicare booklet that helps you just understand general Medicare and why you have to have it. Kind of gives you an idea of the different options that are available to fill in those gaps, such as helping you understand Medigap versus Medicare Advantage plans. But ultimately, you'd want to have a retirement benefits meeting with one of us so you understand our benefits and how it works for you. Like our questions are kind of dying down here in the chat. Someone asked if we will email the presentation. We are recording the presentation, so it will be on our benefits website. But also, if you like the actual slides, feel free to email retirement@uky.edu, and we will send you a copy of the PowerPoint slides.
Hi, Terry. I just sent you an email asking for my years of service and exact insurance payment. And
Okay.
I will turn 62 18 days after I put in for retirement. Should I wait until I'm 62? You can answer all that in the email if you want to.
Yeah. Yeah, let me to if I should be able today to look at your email. You said you're 62?
I will be on June 20th and I'm supposed to retire June 2nd.
Oh, if you're in that age service matrix, I would possibly consider changing your date to after you've had another birthday.
So
But let
July.
me look at your service time and everything, make sure you're in that age service matrix, and I'll be sure to respond to your email.
Thank you so much.
Okay, you're welcome.
There was also a question in the chat about the TDL time. Terry, can we go back over to the TDL slide earlier on about
Yes, of
converting time?
course. Yeah. I didn't see that in there, so you might have to ask the question, or if you want to
Yeah.
answer it.
All right. So the question was, can you go over the use of TDL time to add on to retirement? Now, what that effectively means is if you have at least 66 days of TDL time, which is for a full-time employee, approximately 528 hours, you can use that time to buy forward your years of service. So when calculating your age service matrix, you can use your TDL time to buy forward additional years of service, not your age, but your years of service. This typically doesn't affect most retirees, but what it is, especially if you're going to be eligible for the age service health credit, you can use that time to potentially buy forward you into the new bracket. So for example, if you have 24 and a half years of service and you've got 6 months of TDL time lined up, you could potentially buy forward your service time from 24 years to 25 years. That tends to be the most that we see people use it for. Most of the time, like I said, you can technically buy forward your service time towards early retirement, but it doesn't tend to be quite as beneficial. Does that make sense?
Yeah.
As far as the TDL conversion time, that's really going to be more of a question for leave administration, but typically speaking, you are allowed, I believe, to convert your TDL time to vacation time every April down to a minimum of 66 days. So if you have exactly 66 days, they're probably not going to let you convert it. But, potentially next year, if you have over 66 days, they'll let you convert down to 66 days.
And there's a question in the chat about someone's spouse has many health issues. They were advised to Medigap, that Medigap plans were more difficult due to Medigap rules, but generally Advantage plans to Medicare Advantage is possible.
So let me explain that because I
yeah.
have the full context of that.
Okay.
Basically, the person in question was asking, with the Medicare Advantage plan, they have heard that it's hard to switch from a Medicare Advantage plan to something else. So if you're switching from Medicare Advantage to Medicare Advantage, that's generally okay. Now, as far as switching from Medicare Advantage to Medigap, basically the way that it works is I believe you have approximately 3 months after enrolling to Part B to sign up for a Medigap plan. If you sign up for a Medigap plan during that 3-month window, it's basically guaranteed issue. You just get it, right? If you don't take Medigap plan during that 3-month window, you can potentially go on to a Medigap plan later. However, what that effectively means is they can then, either deny you coverage or increase your rates based on previous health conditions. The UK Medicare Advantage plan doesn't have that issue. So potentially what you could do if you're on the fence is go with a Medigap plan first, see how you like it. If it's too expensive, it's not worth it to you, you could always add your spouse back on during Medicare open enrollment or with a qualifying event. Because remember, with spouses, there is no one-time deferral form. You can add or drop a spouse more or less as many times as you like, either with a qualifying event or open enrollment. So potentially, especially if you were maybe given advice to consider a Medigap plan, you could always potentially do a Medigap plan for your spouse, see how it works out. If you don't like it, they can always come back onto our plan. The only restrictions is you have to show proof of at least 1 year prior health coverage, so proof of the Medigap plan, and then proof of prescription coverage since you turn 65, which is typically going to be included on a Medigap plan. Any other questions? These are good. You're all keeping me on my toes today.
Well, I think for purposes of just wrapping up on time, hopefully this helps give you some general information, and feel free to reach out to us individually or at the retirement@uky.edu email, and we'll be happy to follow up with and answer any questions that you may have. Everybody have a good rest of the day.